I think there's been a tremendous amount of advance in understanding the dimensions and distribution of cancer as a growing global threat. Not only about the types of cancers in each region, but also the magnitude of how it is affecting larger numbers in terms of cases, deaths, and quality of life, with gender distribution and socioeconomic distribution also understood, and some of the causes or etiological factors also identified. There's been also a great deal of advancement in diagnostics and treatment. While we have a fair amount of knowledge about the causes and a reasonable amount of knowledge about what are the effective interventions, the ability to effectively introduce them into the health system and efficiently deliver them for the benefit of people is certainly lacking to the extent that is needed. Preventive services have not been adequately incorporated into primary care, nor have been diagnostic services, because you need an early pickup for effective treatment. And even if primary care has succeeded in picking up cases, the continuity of care, connectivity of care to higher centers when needed, and the affordability of care, all of these have been considerable challenges. And therefore, despite the advances in knowledge, the utilization of that knowledge for the benefit of people, for prevention of cancer, for diagnosis of cancer, for treatment of cancer, rehabilitation, palliation, and supportive care, all of these elements have not come about to the extent needed. The way forward is very clear that we do need to implement primary care-led universal health coverage very strongly, so that many of the preventive measures as well as early diagnosis are possible there. But we cannot rest on that alone. We need to build in also competent services at the secondary and tertiary care levels and connect them to primary care. But most important of all, we need to make care affordable. And we also need to strengthen our health workforce so that we can actually have people who can deliver the wide range of services that are needed with the required efficiency and empathy. So these are some of the things that we need, particularly if we are aiming for equitable delivery of efficient services.